Hello, my name is Jasmine McWhite, and my project is on severe combined immunodeficiency. Severe combined immunodeficiency is the most serious form of primary immunodeficiency disease where the hormonal parts of the immune system fail to work properly. A child will inherit a copy of the gene from each parent through the X chromosome, and the gene will either be inherited X-linked recessive or autosomal recessive. Each parent of the child are carriers of the gene. The T cells are abnormal and will affect the functioning of the B cells. The thymus and lymphatic system hold and transport the T and B cells that fight infection. The mutations in the interleukin receptor gamma chain gene, or the IL2RG, stops the production of the immunoglobulin protein that the T and B cells need to fight infection. Symptoms include stall growth and weight loss due to diarrhea in early on in children. They will have serious infections such as sinus and ear infections, skin infections, liver infections early on that are persistent, and they are not improved by antibiotics. They can have deep abscess in their skins, swollen abdomens, and yeast infections such as thrush. And SCID can be found through blood tests. The T cell count can be identified through tissue samples using enzyme labeled antibodies. You can they can be it can be detected through X-rays as well. Now, usually the full medical exams are not ran until there is a pattern of recurring infections signaling the immunodeficiency. One in every 500,000 children will have SCID. All areas of the world are infected by this. There can be cases in all ethnic groups, and males and females can be infected. Typically, the X linked SCID occurs mostly in boys. To have a normal quality of life, a bone marrow transplant is needed. SCID can be treated with antibiotics and immune serum to protect the patients from infections. Gene therapy is used to replace the normal IL2RG with normal with a normal copy using stem cells, and long-term immunoglobulin infusions can be used as well. Currently, there is no cure for SCID. Unfortunately, if if it goes untreated, where um, the child is not treated properly for SCID, they can die between 1 and 2 years. With severe cases of SCID, the quality of life for the patients is poor without a bone marrow transplant. With the transplant, a patient can lead a normal life, such as playing and playing with other children, interacting with other people. Um, but they would need to have medical exams conducted every 6 months to a year by a physician. According to the National Center for Biotechnology Information, the oldest known serious survivor of SCID lived into their 30s. And of course, with advancement in technologies, they're hoping that they can find a cure for it. But as of right now, a bone marrow transplant is the best way for someone to survive with SCID. I hope that you have learned a lot today. Thank you for your time.